Urban
Health
Institute.
It is
The bridge
connecting Baltimore and Hopkins.
A vehicle to inform people.
Stellar. It's absolutely stellar.
Audacious.
Hopeful.
real possibilities.
Very collaborative.
Courageous.
God-sent.
Connector.
Bridge. The bridge acts as a support for those who are traveling along the way.
The president often came to the board meetings of the advisory board. One time he came there with an idea about, he called it what it is, Urban Health Institute. And the board was sort of quiet about that.
There weren't a lot of conversations going on between the university and the residents who were living around the university prior to the Urban Health Institute.
Whenever a problem exists in East Baltimore, Hopkins has always been a whipping boy.
The community felt as though it was outside and it was just looking at this institution that was sitting there in our community. Nobody knew how to get in, nobody knew who to talk to.
John Hopkins had always wanted to make inroads into the community, but quite frankly just didn't know how to do that.
When you don't talk, so much invisible walls come up.
By creating the Urban Health Institute, that was a statement by Johns Hopkins, the School of Public Health, and the other entities that make up the Urban Health Institute. We're interested in the community.
Central to the role of the UHI is building relationships. You build relationships in part by doing what Hopkins does best, and that's educate, train, and support.
When I heard about the Community Health Initiative, and I met Dr. Blum, and interestingly, I met him at their holiday party, and we had a conversation about how to engage community. What a concept. And so he asked me would I attend one of their meetings. I said, sure, and as you can see, I've been here ever since.
Because a relationship is based on trust, and trust is based on having open dialogue. And it requires coming back to the table repeatedly.
The fact that the Urban Health Institute created a number of groups and boards and interactive opportunities goes well beyond the conversation. It starts building relationships that allow us to have some trust.
Trust matters a great deal. In the absence of trust, it's very difficult to make progress.
But it's a trust that has to be reestablished, and that's what the Urban Health Institute has been doing with the workshops, it has been doing with the book clubs, it has been doing with the strategic planning.
At some point, if we're going to resolve the problems and we're going to have some kind of real relationship, we have to deal with truth. And my truth may be different than your truth.
We can't deny the racial inequalities, the health disparities of East Baltimore, and many of those inequities lay in the social determinants of health. And they're very delicate conversations, and not often welcome conversations. But one thing that I find about the Urban Health Institute is that it really gives a forum to be able to have those important conversations.
If you look at the lineup of speakers, they're extraordinary people. And these are people who have a view that needs to be discussed in the community. Around issues of race, power, and relationships.
I didn't know how to get in front of scholars. UHI put me in front of Brown scholars. To this day, I'll just give you one example. Brown scholars are right now, we're about the partnership because I need an analysis done, right? And I need to do some measurables and some things. Is community policing effective? I could talk about it, but they can actually make it happen.
To have that up and close personal contact with the commissioner and different people, it's an opportunity for people to voice their opinions and share what they are doing and what they see as an issue.
The most fundamental right that all of us have is to have equity in healthcare.
It's very sad when you think that the zip code in which you're born largely determines the future of your life in terms of education, social status, happiness and also your length of life.
Well, one of the most remarkable things that UHI has done is to really lay the foundation for the formation of the Access Partnership. Bob brokered a meeting between the leadership of the schools and the health system here on this campus and the community. And what came out of that meeting was that people felt they did not have access to care.
Just talking about HIV and tuberculosis, if I just use those two areas, we were in the top 10 from what I saw back then in 2008 in the nation. That little zip code right there where Hopkins was. Well, we fell off that list just because the doors open and the avenues open, and UHI Hopkins came out into the community. It started with one zip code and now it's up to maybe 7 zip codes.
Wouldn't have happened without the Urban Health Institute.
The community health worker program predated me. And this identified and trained individuals in the community to do basic health care in home and in community health care. This program now has expanded through a federal project that's a collaboration with our community partners, JCHIP.
And so out of JCHIP was formed Tu Maini that allowed 2 community-based organizations that were a part of the collaborative, Sisters Together in Reaching, better known as STAR, and the Men and Family Center, to come together to create a unique opportunity to be able to hire members from the community and to train them either in the areas of community health workers and or neighborhood navigators.
We've institutionalized what started as a small program.
We're talking not just in hundreds or thousands, but now probably tens of thousands of people that have benefited.
We know that schools and community well-being are inextricably linked, and if you don't have a high-quality school, including high-quality early childhood experiences, it's really difficult to maintain or sustain the vibrancy of a neighborhood.
Today, in East Baltimore, not only is there a Henderson Hopkins School, but there is a Weinberg Early Child Development Center that's contiguous with that school.
We have families that had no other options for childcare in the community. And what we ended up with is what's now held up as a national model.
We have an exciting school clinic there where we're working with the community to advance health outcomes.
Wraparound services such as parenting classes, literacy classes for parents.
It all started with a conversation with Bob Blum and the Urban Health Institute.
Every organization has its strengths, and one of the things that UHI has done is to do asset mapping in the community. What are the strengths of the community? And then look at how we use those strengths to strengthen Johns Hopkins, and the same on our side. What do we have here at Hopkins that we can use to build a stronger, better, healthier community?
We used people from the community who understood the community, who already had the relationships across East Baltimore. They could go out and actually talk to people, meet people that they knew, who would then lead them to other people. Instead of bringing them the solution and saying, here is the solution for you, and giving it to them, ask them, what do you feel is your solution?
Reverse Research Day really began as an idea generated by Josh Sharfstein when he was Commissioner of Health for the City of Baltimore. And it was to have city organizations and agencies say what they need for research.
Small grants programs which have afforded faculty the opportunity to receive small awards for work they are doing in tandem with community partners.
We've done work on liquor stores, on food deserts.
Creating opportunities for these conversations to occur is not a trivial contribution.
Tackling the difficult issues.
You see a great when the community is more receptive and the community becomes informed and aware of things and services that they had no idea was in their backyard.
It transcends any one department or research group or advocacy group.
It is the entity that brings us all together.
They've contributed to cultural competence. That's a knowledge of other people through affiliation. You don't need a class or a textbook. If you have the people around you